making research ethical. So I'll be drawing, as Ella and Rob are doing, from the published and the grey literature. I think it's fair to say, though, that ethical issues came up repeatedly throughout the workshops as well, really sort of underpinning lots of the issues that people were dealing with. So some of the ethical challenges I'll be looking at, obviously, the whole thing of continuing, resuming, postponing, finishing, starting new research, all those sort of temporal aspects, participant and researcher risks, well-being and relations, change of methods modes, we've mentioned that already, the ethical aspects of that, and support and guidance in terms of ethics. Ligayo and Karagata, that they expand on the sort of the procedural ethics that we associate with getting ethical approval and governance and all of that, primarily around sort of risk to participants. And they draw on sort of critical feminist approaches to draw on researcher positionality and sort of some of those wider relational aspects of ethics, which I think is really important. And other authors that we've looked at have widened their ethical discussions to include the sort of the ethical and moral dimensions of COVID and the pandemic, and the interrelation between those and those sort of academic ethics that we're familiar with. Kara and Ku remind us that, you know, rethinking research planning is an ethical imperative. Social research can contribute to you know, these aspects, these unique aspects of the pandemic. But do we want to carry on? You know, do participants want to continue? These are the dilemmas that we're looking at. I think it's important to recognise, and this came through certainly in the literature and the workshops, there is a natural instinct for researchers to want to obviously continue with their research, but also to respond to the pandemic and to conduct research in relation to that. Especially as obviously social research is often focused on disadvantaged and marginalised communities, who, as we know, have been disproportionately impacted by the effects of the pandemic. But then the dilemma is that potentially puts them in an increasingly vulnerable position as participants. So, you know, these sort of interrelated and multi-layered set of ethical considerations that we've really came to the fore, I think. For those who are continuing with their research, obviously ensuring you know, participant well-being is obviously always a key priority. We have to reconsider ethics in response to the effects of pandemic, the potential effects of the pandemic on participants, but also the effects of adaptations to the methods that we use and the change of modes that we've talked about. Re-establishing trust and rapport, I think, was really important. And really that question of how are participants dealing with the pandemic. I want to draw on the workshops in particular here, because that sort of heightened relationship with participants came up very much in the workshop discussions. As one of our participants mentioned, you know, as a researcher, you might be the first person that a participant has spoken to for several months, you know, in our lockdown sort of situations. And there's that real uncertainty of how participants are dealing with the pandemic. They may have experienced bereavement, they may have lost a job. And as another participant said, another participant in our workshop said, you know, how do you even start that conversation? You know, the real ethical issues there around engaging with participants and, as I say, re-establishing that rapport and that trust with them. very strong feelings from the workshops of people not feeling that they've been trained to deal with some of the emotional responses of participants, and the whole continuing with research. There were others who said they've really been able to draw on previous work experience, perhaps in social work or social care or counselling. They really felt at an advantage in terms of being able to draw on those skills, but didn't feel that those types of skills are typically found in our researcher training, our academic training. Also, some really interesting aspects of promoting participant well-being in research. Sharon Ravitch, in an interesting article, she talked about reminding us that we are all connected and dependent on each other and responsible to each other, and really drawing on that aspect of the pandemic and that sort of collective feeling of us all dealing with the issues of the pandemic. And she draws on some established models that she uses. And quite a few writing about and discussing methods for promoting sort of well-being, those therapeutic aspects of participants engaging in the research, particularly reflective methods such as diaries and discussing photos and that type of thing. That's all sort of photo voice type methods and all of that, and a focus on sort of the positive aspects of engaging with research and how you can sort of document and reflect and all of that. We had one of the researchers from the Mass Observation Project on with us on one of the workshops, and she talked about real quite big increase in the responses from their writers that are involved in that during the time, and also an increase in people wanting to volunteer for it as well. So that real sense of people wanting to contribute to documenting this sort of historic period, I guess, and perhaps some of the benefits that might come from that. Mel's mentioned obviously the onlineification, if you like, the pivot to the online. Of course, it's been a significant shift of methods. We've seen that in terms of moving methods online and into digital spaces. And of course, that change of mode has given us, has obviously given us new ethical concerns, particularly for researchers who are not used to using these particular tools or approaches, obviously, and confidentiality, data security. We've already mentioned, I think we've already had some mention in the chat already about recording of these things. Difficulties of assessing risk to participants remotely, that was certainly a key concern for some researchers. I think there is a feeling as well that generally online ethics is a bit of a grey area at the best of times, and obviously with the fast changes in the technology and the way in which they're used, I think that it was a real concern. And obviously there's different ethical dimensions to the digital divide in terms of representation and involving participants and all of that. But we did see some examples of affordances of technology. I'll give you one example. I mean, one of our workshop participants described how they use Zoom breakouts for sort of vulnerable and anxious participants, to give them that space and to have time with them. So the technology can be used in positive ways in terms of the research process. There was a sense in terms of the support and guidance, there is a sense that ethics committees are seen as risk averse, although as somebody from the workshops did, point out, it has been a perfect storm for them. They've obviously had higher workloads, higher, need people responding, wanting to you know, to redo ethical, you know, to ethical clearances, you know, combined with reduced resources in terms of them. And of course, like everybody, they're responding to what is, you know, a dynamic situation. There's a few interesting examples in the workshops of having to negotiate multiple ethical procedures across countries and institutional ones. We had an example of somebody who does research in the courts, you know, different types of ethical procedures to deal with, not just necessarily academic, and you know, in terms of their university. And really, I think overall, just a real need, a sense of needing guidance and support, and perhaps particular COVID-related examples, I think, with the whole support and guidance. So in terms of the relational aspects, I mean, just picking out some of those, of course, we have responsibilities towards our co-researchers, our co-workers, you know, our own well-being and mental health, particularly perhaps, you know, those who are doing field work, you know, local researchers, etc. A workshop participant said that, you know, reminded us that ethically we are accountable to funders and research partners and to various other stakeholders, which might give a reason why we, you know, this tendency to be perhaps a bit risk averse in some cases. And then I think a really significant thing, again from the literature and the workshops, has certainly been this increased recognition and reliance on local gatekeepers, on research partners in the field and local researchers. Really a significant thing, I think, that's worth pointing out. And in particular, expanding that into sort of global south research and lower middle income countries research into that. In particular, I mean, Items, which is the blog of the Social Science Research Council, they published a series of posts from researchers, from local researchers from these countries, particularly experiencing crises situations, you know, really experiencing and exploring disruption to fieldwork with, and they've all got a real strong focus on sort of ethical dimensions of this. And I think notably they really seized upon COVID. They really saw COVID as an opportunity to promote the role and the significance of local researchers, and a real sort of call for greater equity, and almost a sort of decolonization of global South research, really, you know, dealing with those inequalities between the sort of facilitating institutions and the local researchers in the field. So really interesting set of posts, and I'll share those in the chat perhaps a bit later. And I just wanted to finish really with this essay from Shabana, I think it's Shabana, sorry, Shankar. She highlights the absence of emotion really from academic discourse. She describes it as a form of scholarly social distancing, which I think was really nice. And she does call for this sort of this new ethical turn, where emotional aspects of our research practices are, you know, can be seen as productive and valid. So with that, I've got the links there, the references there, which you can follow, as I say, when we do share these slides.